Hey, everybody. Welcome to the very first installment of the Gladden Society Resident Podcast Series. This is a series created by residents and fellows for residents and fellows, and it's designed to cover a wide range of topics that we felt would be beneficial to us, both within the training setting and afterwards as young attendings. And to gain this knowledge, some of our very own Gladden Society faculty and emeritus staff have graciously agreed to be interviewed and provide us with this valuable insight. And I'm Malik Dancy. I'm a PGY-5 orthopedic surgery chief resident here at Mayo Clinic Rochester. I'll be your host for today's episode entitled Securing Job Opportunity After Training. And for this episode, we are joined by one of my biggest mentors, Dr. Kelechi Okoroha, or as we call him, Dr. O. Dr. O, welcome and thank you so much for being willing to join us today.
Thanks for having me.
Absolutely. Dr. O, would you mind telling us a little bit about your background, your journey into ortho thus far, and the current positions that you hold?
Yeah, so I grew up in Houston, playing basketball. I always wanted to be a basketball player, but fell short of that goal, and became an orthopedic surgeon. When I became an orthopedic surgeon, I toyed around with emergency medicine, neurosurgery, but ultimately settled on orthopedic surgery because I wanted to do one, something that involves sports medicine, and then two, something that involved my hands. And so my journey was Howard for a medical school. I did my residency in Detroit at Henry Ford, and then I did my 1 year sports fellowship at Rush. And right now,
Perfect.
I'm an orthopedic surgeon and sports medicine surgeon at Mayo Clinic in Minneapolis, and I'm also the team physician for the Minnesota Timberwolves and Minnesota Lynx.
Awesome. That's amazing. Well, I'm also going into orthopedic sports medicine, so I hope that I'll be able to emulate some of what you've accomplished thus far in the field. So for this reason, and with you being relatively early in the practice, we felt that you'd just be a great person to speak to regarding today's topic. Throughout residency, the focus, rightfully so, was on gaining orthopedic knowledge and developing surgical skill, but the general consensus is that there's typically a lack of formal education during residency training on getting jobs after we're done. So, with today's rapidly changing job climate, the large percentage of surgeons that switch jobs within the first 5 years, we felt just having a basic framework to approach securing a bag following training would just be super helpful for us. So, that being said, first question for you was regarding choosing the right practice setting.
Yeah.
Could you provide us with just like a quick overview of the various job types and considerations for each one?
Well, I think there's a lot of different considerations, but ultimately you have to pick, what fits your model, what fits your family. And so there's a bunch of different models. You said one thing that I want to touch on first is there's a rapidly changing environment, right? And there's a large percentage of surgeons that switch jobs with their first years. I fell victim to that. And so it's at least a third of orthopedic surgeons going to practice and change jobs within the first 5 years. So that's telling us that we're not picking the right kind of jobs. So it's ultimately important that you know the list of things that you want to accomplish or what you want in a job, and then pick from there.
Mm.
So there's a couple of different kind of jobs. Number one is the solo private practice. That's going to be where a surgeon operates independently. They own and they manage their own practice. There's going to be some advantages to that, being that you have complete autonomy. You can hire whoever you want. You can fire whoever you want. Your schedule is going to be completely flexible, and your revenue is going to be directly billed to what you bring in. Challenges of that is the overhead cost, the administrative burden of hiring all these different people and managing them, and then you're kind of isolated. The next step would be the group private practice, single specialty. So it's a single group of orthopedic surgeons specializing in a specific area. Obviously, you're going to get that structure. You're going to share the resources, so it lowers that burden. You're going to have a little bit of collaboration and greater market power when you're talking to insurances. Obviously, the challenges is whenever you're bringing a group of people, you have to make a consensus before making decisions. There's going to be a little bit reduced autonomy, and then obviously profit sharing. Third type is a large multidisciplinary group. So that's going to be orthopedic surgeons that work within a larger group that includes various subspecialties. The advantage of that is you're going to have the comprehensive care. So when a patient comes to see you, they can also see a cardiologist, they can also see a nephrologist, and that's going to increase their care and ease of care. Your resources are going to be greater. You're going to be able to share that, and you're going to have a referral pattern based on your partner. So your non-op surgeon, physical therapist, your non-op medicine colleagues are going to be able to send you patients. Obviously, as we get down this ladder, you're going to have less autonomy, It's going to be more complex of an organization, and obviously you're going to have some profit distribution. Then the last two models are the hospital employed, that's non-academic, and the academic practice. So with the hospital employed, it's going to be surgeon employed by a hospital or a health system without an academic affiliation. Advantages of that, you're going to have a stable income. So you're going to have a guaranteed salary. Sometimes they have bonuses that go that's tied in with performance metrics. You're going to have a reduced administrative burden because the hospital is going to basically take care of everyone's hiring, billing, administration. Then you're going to have access to facilities. So you're going to have access to hospital facilities, support staff, and resources. Obviously, with the hospital employed, you're going to have the least autonomy. You're going to be expected to produce, right, to cover your salary.
Mm-hmm.
And then there's bureaucracy in that, with changing rules. Everything is not going to be as simple when you want to do change something. Mm-hmm. And the other end of that is academic. So the same thing within an academic affiliation. So the positives of that, you're going to get an intellectual environment. You're going to be able to collaborate with a group of people and advance your career. And then downside is lower compensation. You're going to have to do some research and training. If that could be a pro or con, depending on who you are. And then obviously there's going to be some administrative complexity. So that's a simple breakdown. We can get into a little bit of each one if you want to, but that's a simple breakdown of different practices.
Perfect. No, that makes a lot of sense. So, with those things in mind, when should we start looking for a job? Do you think it's early on during residency if we already know kind of the geographic location that we want to be? Is it after fellowship match? Is it during fellowship? When's kind of the ideal time for somebody to start approaching this hunt?
Yeah, there's never a great time. You have to start it when you feel comfortable. I think if you talk to enough people, they'll tell you that you probably want to start looking at the end of your 5th year, going to fellowship. I wouldn't sign anything in residency personally. I think as you learn and as you get into fellowship, you start getting a little bit more of the business model. You start seeing what's available. And as a company, they're looking to get the most out of you with the least pay. So a lot of companies will try to sign an orthopedic surgeon in residency because they can get them at a lower price point. They promise them some stipends or something going to fellowship, and it sounds really sweet, but then they lowball you on the price. They might not get you the resources you need, and a lot of people fall into that. So
yeah.
I would suggest waiting to fellowship. That being said, I didn't do that. I signed right before I went to fellowship, but I made sure I got a pretty good deal.
Okay. With consideration, I guess, after we decide, one, what type of practice that we ultimately want to pursue, which one of the ones you described resonates with us the best, how do you actually start the job search? Do you just cold call people, you email people, how do you take those initial steps?
There's a lot of different ways to look for jobs. I think cold calls and emails is great if you know an area you want to be in. So let's say you want to be in Florida, you know all the potential practices in Florida. Yeah, reach out, call, email, say, hey, I'm looking for a job. This is my CV. Do you guys have any openings? And that's a great way to show your interest. You can also leverage your network. So all the orthopedic surgeons in residency and fellowship, your mentors, you can reach out and say, hey, you're looking for a job. Does anybody know of any openings? Then there's also conferences. So AOSFM, and there's a lot of booths specifically tailored to job search, and a lot of people interview at those different meetings.
Gotcha. Okay. Does anybody use like LinkedIn or anything like that? Is that a thing for orthopedics or not so much?
I think it is. It's not widely used, but I've been approached by someone on LinkedIn for a job.
Okay. Have you heard of any of these like job boards, like jobsinortho.com, anything like that? You familiar with any
I've
of
heard
those?
of them, but I think those are valuable options as well.
Gotcha.
I think
Okay.
the job market is getting so competitive. I think you should have to try everything, especially if you know you're in a defined location that you want to be in. That makes it even more competitive, and you have to do all these different things to get your
Got it.
out there.
So personal anecdote for me, I found out that my phone number got leaked online somehow. So pretty much once a day, I get a text from some recruiter somewhere, job in, Des Moines, Iowa, paying, $1 million a year type deal.
$1.5 million for Alaska.
Yeah, Exactly, exactly. Have you ever heard of anybody having, good experiences with those job recruiter type situations or slash, have you had any experience with that personally?
Yeah, so I think, there's a reason why they're reaching out to multiple different people, right? They're just
Yeah,
just casting a wide net, and that's because those jobs are probably less desirable.
yeah,
I think the pay is really high, but your practice environment's not going to be great. It's probably not going to be a good working environment. So for some people, it works because they say, hey, I'm going to go out there for 3, 5 years and make a ton of money and then come back. But those people often change their jobs within the first couple years for sure.
gotcha, gotcha. Okay. Now let's say, stars align. You got a ideal job that may be interested in you that you're also interested in, and now it's time to actually go about prepare for your interview day. What does that look like for you to try to prepare for a job interview?
Yeah, so I think it's important to research the institution. You got to know about their culture. You got to identify the key players, who's the managing partner if it's private practice, who's the CEO, who's the chair, what their goals are. Does it align
Hmm.
with your goals? And you have to talk to people. So you want to talk to all your potential partners. You want to talk to very important people, which are people that just left. So
Hmm.
anybody that, left on their own, got fired, you want to talk to them and see what's the environment. And then on your interview day, you basically want to talk to as many people as you can because you're there for an isolated amount of time. And so if you just go in and you get a 30-minute view, it's going to look sweet. But you have to make sure you talk to everybody, kind of try to get a feel of what the culture is and if you would fit in there.
Okay. And you mentioned, the interview day itself. I feel like things may have been affected because of COVID, at least in the recent past. I don't know what your personal experience was along your timeline. Was your interviews or interviews you've heard about been in person generally, or are they virtual? How are people doing things these days?
Yeah, my interviews were in person because it was right before COVID. I
Oh,
think
okay.
there was a limited amount of time where you can travel. But I think nowadays you want to do it in person. I would not do it virtually because you need to
Hmm.
see the environment. You need to talk to interact with people. Over the phone, everything could look better than it actually is. So I would definitely recommend in-person interviews.
Are these things typically like staged? Like you got one that's going to be over the phone and you're talking to people, and then you come out for a site visit, and then maybe you come out for like a OR day, or is it typically just a single interview day rather than spread out across multiple days?
It can be both. It just depends on the institutions. People do things differently. But yeah, if you can get out there and meet some people, if you can get in the OR, if you can come back, and also another thing, you want to meet people's families. So if you have a wife, a significant other, you want to bring them out there, see if they get along with the other, wives, and
Hmm.
see about the kids, where people are living, where they going to school. So you want to get the work environment, but you also want to get the family and the home environment as well.
Understood. Are people still doing like pre and post dinners? I know for fellowship interviews, which I just got off of, a lot of people are having pre-interview dinners the night before your interview day, or even sometimes post-interview events. Is that still a thing? Do
Yeah, it's
people
still a
places
thing, and a
make?
lot of people will schedule dinners. So when I came out here, I had dinner with couple of different consultants. So I think that's good because when you're at work, it's a lot of professional talk. Well, when you get into dinner, you get to have a nice, casual, relaxed conversation and see what people
Yeah,
are really like.
yeah. Now you say casual and relaxed, but are these interview dinners and post-interview events still very much part of the interview day? I feel like it was on the fellowship trail. Is it like that on the job trail? This is all still being interviewed.
Yeah, it definitely is. So it's casual for them, but as the interviewee, you always want to
Hmm.
be on your P's and Q's. So you always want to make sure you're saying the right things, you're not upsetting anybody. Be yourself, but at the same time, it's just all part of the interview.
Gotcha.
They're not
Okay,
going to discount anything you say at dinner when they're talking, going back to the other colleagues and saying, "Hey, do we want this guy?" Now they're going to be
makes
like, "Hey,
sense.
at dinner, you said this weird thing about." So make sure you're always on your P's and Q's.
Got to be. Okay. How about like tips for the interview day itself as far as your personal attire? I you're a sharp dresser, you're known for that. So, yeah, what are your approaches to interview day dress attire? I think back to my own kind of fellowship interview, you try to look nice, but you don't try to do a lot. Is it the same thing for a job interview or?
Yeah, so I've always been taught your appearance is one of the most important things, because that's the first thing people see. So before they hear you talk, before they look at your CV, they're gonna look at you, and they're gonna, I'm not saying it's right, but they're gonna make a judgment by the way you're dressed. So you always want to
Okay.
make sure as they go down the list, you're checking off all the boxes. So they first see you, wow, this guy is nicely dressed. I can tell, he has a good personality. Then they hear you talk, they're like, oh man, this guy is great. Then they look at your CV. So you always want to make sure whatever you put out in front of them is a positive. So I think you want to dress
Hmm.
your best. You don't need to
Hmm.
wear a three-piece suit and, do something ridiculous, but you have to have a nice clean suit, tie, clean shaven, all those kind of things.
Clean shaven.
Well, I mean, lined up, I should say.
Lined up.
You don't have
Okay.
to shave off
Okay.
your beard, but
I was about to say, let me go ahead and head on
yeah,
out. Let me get out of
yeah,
here.
no, no.
But well, all right. So you mentioned nice suit. Sometimes you hear stuff about all black suits, navy suits, different colors. Any tips on that? Any insight onto that, or you don't think that so much matters in 2025, 2024?
Yeah, so I think the color is not so important. I wouldn't wear this suit to interview. All right, it's a little bit too loud. You're the interviewee. Now, as an interviewer, I might wear this, but that's not your job. You come with a clean gray, blue, or black. You don't want to have some
Mhm.
multi-pattern checkered thing that people. You don't want to give people reasons to talk badly about you,
Yeah.
especially if they're not feeling the outfit. Oh man, what did this Malik guy have on? You don't want that going into it.
Right.
Just something
Got
nice,
it.
simple, nice blue, black, gray suit, and a nice tie.
Okay. Do you obviously at some point during the interview, you're going to sit down with somebody, have some one-on-one time, and you may get into the nitty-gritties of like financials. Do you, or if you don't, do you bring up money up front on that interview day, or do you let them bring it up? How do you go about this, obviously a very important part of
Yeah.
your job there?
Yeah, it's a very important aspect, and I think a lot of people going into orthopedic surgery and going into job practice don't know how to tackle the money part or talk about it. And
Mm.
so I wouldn't bring it up, but it definitely needs to be discussed. So at some point there should be an offer letter, and when you get that offer letter, you have to look at it and see if it aligns with your values. Never be ashamed to ask for more. I guarantee you at least 50% of people ask for more on their contracts. The worst they could say is no. But if you don't ask, you'll never find out.
Yeah.
So that's definitely something you should talk about. You should talk about a bonus. You should talk about what kind of help you're going to have. If you're going to have ancillary staff, you're going to have a PA. I recommend all orthopedic surgeons that are sports medicine specialists start with a PA.
Mm.
A lot of jobs will tell you that that's not possible, or the way they do it is you come in, you work a couple months. That's not the case. And then the most important thing I'll say is that about contracts is everything is negotiable. I don't know how many times I've talked to a junior resident and they're like, hey, they're at this big institution, they have this standard contract. If you want to listen to that, it's up to you, but everything is negotiable for the right person. Now, you might not be the right person, and that's why you might not be able to get that, but everything in a contract is negotiable.
Good to know. After the interview, I've heard various things during other interview cycles I've had about sending thank you notes and follow-up communication, circling back. Is it thirsty? Is it appropriate? What's the way to approach that?
Yeah, I would definitely send some type of follow-up communication, whether it's email, hey, I had a great time at the interview, X, Y, and Z. This really aligns with my values. I think I would be a great fit. Something short and sweet that let them know that you really liked your visit and you would love to
Mm.
work there. And I would do that kind of immediately. So some people, wait 2 weeks or a week. I would do it like within a day or two, just so it's fresh
Yeah.
on their minds before they go talk to other people. They have that.
Now you mentioned talking to other people. Um, at the same time that they're interviewing multiple candidates, I assume, a lot of us probably casted a kind of a wider net as far as jobs that we've applied to. So, given that we are interviewing at different places, how do we broach that? Is it an awkward conversation? Does, the places frequently kind of bring that up? Like, where else are you looking at? How transparent are you as an interviewee about that?
Yeah, so it's less common than you think because this is not like a fellowship interview where they lined up, 8 different people on the same day. Job
Hmm.
search is kind of an individualized process. So, you might interview and they might not have another person interview for another month, So
Uh,
you won't really know unless you ask, and they won't really know unless they ask you.
hmm.
And how you answer that just depends on how you want to play it. So if it's your dream job and you want to go there, I would not mention it. But if you're kind of debating between two and you might need it as a negotiating power, you might mention, if they ask you, oh yeah, I interviewed at this place and they want me to come out. It's up to you.
Okay. All right. Now let's say again, stars align and this place likes you and you like this place and at least the interview day logistics went well and your offer sounded okay, or maybe there's some things you want to tweak about the offer. How do you negotiate a contract? You mentioned you kind of touched on that earlier. Do you utilize an attorney? Do you just kind of go at it on your own or you run it by your mentors? How does that work?
Well, I would do both. So I would run it by some people that you trust to give you some honest opinion about it. A lot of surgeons were stubborn, right? So we'll get advice from 2 to 3 different people, but we think we're different.
Hmm.
So I fell victim to that. I think when I was interviewing, I talked to my chair at Henry Ford, and he wanted me to come back, but he said, Casey, I'm going to be honest with you, I would wait till you get into fellowship. But when the chief wanted to get me in, he's going to sign that paperwork if I want to come. But, so I
Hmm.
think we all take advice, but we might not listen to it. So you might want to cast a wide net, ask the different mentors their advice on your contract and see what they would advise. When it comes to attorneys, it depends on your comfort level negotiating your contract. I think the pros of attorney are that it's not your voice, right? So you can tell the attorney this is what I want. They can communicate, and it takes you out of the direct communication and asking for things. So I think
Hmm.
that's a pro. Me myself, I rather do things myself. So I negotiated all my contracts because I want to get that direct feedback of, hey, you know, X, Y, and Z said this to me personally.
Hmm.
So that's my approach. Other people, if you're not comfortable with that, I think attorney is a fine option. Both of my brothers are attorneys, so I just had them read over my contract and I negotiated mine myself.
That's convenient. Just keeping it in the family.
Yeah.
That's awesome.
Yeah.
Um, Optics of using an attorney though. You think anybody's weirded out by that? Like, oh well,
No, I think
he's
it's
having me talk
I
to.
think it's standard practice.
Okay,
I think hospitals are very used to that, so I don't think it
gotcha.
comes across weird or anything like that. Perfectly
Okay.
normal.
Something that I've heard about but don't know much about, and I think, kind of the viewers might benefit from is touching a bit on non-compete clauses. You have any experience with that? How to handle that? Could you kind of explain it in layman's terms for us listening?
Yeah, so basically a non-compete contract is a hospital will mark out a certain mile radius around any of their institutions. It's important to note any of their institutions. And
Hmm.
if you were, fired or you left, you couldn't practice within that location. And they do that for a couple different reasons. The biggest is they don't want competitors. So they don't want to build you up as an orthopedic surgeon and then you go work down the street and take all their clientele.
Hmm.
Two, if they give you any kind of bonus or something that's an incentive to stay and they don't want you practicing at a local place. Uh, the other thing about non-compete clauses is they're really hard to enforce. So it's more like a scare tactic. The probability of you leaving a job and practicing right down the street and them enforcing it and taking it to court is really low, but it's something that you need to be aware of. That is actually the part that I would have a lawyer look at because there's a lot of wording that the lawyers can kind of argue or say this doesn't make sense and send it back and give you some edits about.
Gotcha. Okay. Boards collection. Could you kind of explain, what that is for some of the more junior residents, how long it lasts, and then kind of making sure the practice model is set up to help you succeed in this?
Yeah, board certification is really important because it's basically where you sit in front of a group of different surgeons, you present your cases, and they basically say you're a competent surgeon. And a lot of times patients look for that, you being a board certified surgeon to trust you. So what the board certification period is your first 6 months, you get kind of a free pass to practice, get your, techniques down, get your OR staff, get your routine together. Your second 6 months into practice, you collect a certain amount of cases, and then you submit these to the board. And they pick out about 12 cases, maybe complications or patients that didn't have really good outcomes, and they see how you handle it. And so during your board selection period, you want to do everything by the book. You don't want to do that complicated, 4-part proximal humerus fracture that's 3 months old. You don't want to do that on your board selection. And if you do, you might want to do it with a senior partner, who could be listed as the main surgeon on that case. So that doesn't classify into your cases.
Makes sense.
Yeah.
And for this, when you sit for your boards, is this for orthopedic surgery board certification overall, or is this specific to your subspecialty?
No, it's general. So your board
General.
certification is general orthopedic surgery. So you're a board certified orthopedic surgeon when you sit for this.
Okay.
Now, your cases and who you interview with will be based on the percentage of whatever specialty you're doing. So if you do 80% joints, then you're going to be sit down with interviewers that are joint surgeons, and they're going to, have that knowledge base. If you do
Got it.
mostly trauma, then there'll be trauma interviewers, but it's a general orthopedic board certification. Now, there is subspecialty exams, which we can get into a little bit. There's a sports CAQ, there's a hand subspecialty exam that certifies you in that specific specialty. That's optional. Not a lot of people do that, but if you're covering proteins, those are additional kind of things that you can get into.
Okay. Now, you said, you get the 6-month free pass to get your practice set up and your routine down, and then they collect it for another 6 months. And then at what point at what point do you actually sit for the boards? Is it like the second year
Yeah.
of
So
your
it's the second
practice?
year. So the second
Okay.
year. So after your 6 months, you submit your cases. They go over them. 6 months later, they send you the cases that were picked, and you got to get ready to present them. So you end up taking it like a year and a half into practice, or 2 years into practice.
Okay.
Yeah.
Now, if what happens if you change jobs within that period of time?
Yeah. That's a great question, because I did exactly that. So
Yeah.
I was a year and a half in practice. I already submitted my cases, and the job for Mayo came along. So if you leave, you have to start all over.
Right.
You have to stay in that same location for, I think it's 9 months. So you have to be there 2 years and 3 months to get the appropriate follow-up, and then you can leave and still use the same cases. Otherwise,
Okay.
if you leave, you have to start all over. So when I left, I missed the next board collection period already, and so I got bumped back 2 years for
Man.
actually leaving at a year and a
Oh,
half of practice.
okay. And when you reset that period of time, they don't go back and then ask you things from your initial period of time, right? That's kind of off the board. It's a
Yep,
brand new period.
brand new period, and you have
Got
about 5 years to get board certified. So I think I got my board certification my fourth year, but you have 5 years. Otherwise, you have to go back and take all your tests again.
You have to go back and take written boards again and
Yep.
all of that stuff?
Hmm.
Wow. Okay. Well, that's important.
Yeah. Yeah.
Yeah.
So
Well, you
that's
know,
why it's important to try to pick a job as your first job that you're gonna be comfortable. You're gonna stay in for 2 years, 2.5 years, so you can get your board certification. Then after, if you want to
mhm,
switch jobs, I think that's appropriate. But you want to be somewhere where you can get board certified.
makes sense. Okay. Well, that's all the questions I have for you. Did you have any last minute pearls for us about anything we didn't cover?
Yeah, I think the biggest thing is you want to identify a job that fits you and your family. Don't be afraid to ask questions. Run everything by mentors or people that you think will give you some good advice, and then make the best decision for you and your family.
All right. Well said. Well, before we wrap up here, had a non-orthopedic question wanted to ask you, just related to you. I know you do plenty of sports coverage. I know you keep up to date on all the sports. The Olympics just happened. Did you have a favorite event that you like to watch at the Olympics besides basketball? Because that's too easy for you. And did you have a favorite athlete within that event?
So favorite sport I like to watch that's not basketball. Uh, it would have to be either gymnastics or track.
Okay.
So, Simone Biles, did it big, but my favorite athlete at the Olympics has to be Anthony Edwards.
Hey, can't go
Hey,
wrong.
hey, so,
Yes,
gotta
sir.
come. Georgia
That's
boy,
right. No,
Olympic champion.
uh-huh. What do you say? Number one option?
No, we're not. Hey.
That's right. Yeah, we love it. All right. Well, Dr. O, thank you so much again for your time, your willingness to drop some knowledge on us. We really appreciate it. For the listeners, we hope you enjoy. We hope you learned something here today. Please stay tuned for the next installment in our series. We'll be discussing another topic here, how to study for cases and the Audie/written boards with another one of our distinguished faculty members within the Gladden Society. Until then, stay blessed, stay encouraged, and we'll see you next time.
All right. Thanks for having me.